Hi, good afternoon. Welcome to the Stoughton Public Health and Visiting Nurses. My name is Janiece and I've been the director of the Stoughton Visiting Nurses for 4 years. I'd love to tell you a little bit more about our organization. We're located, as you may have been able to tell, on the second floor of the town hall, and we are a combined public health office and a VNA. And a lot of people may not know exactly what the difference is to what we do. So I thought I'd tell you a little bit more about our organization and how we can help the town of Stoughton. I'd love to introduce you to some of our staff that work here at the VNA. We actually have a total of about 18 clinicians, although they're not all here on the same day, and some of them are per diem, but these are a few of the people that work with us. We have Rhonda, who's a nurse, Linda Twomsley, who's in the office every day doing our billing, Janet Crimmins, who's a nurse and also does something called quality improvement, and then Carolyn Swart, who's also out doing visits. So I wanted to tell you a little bit about what we do as far as the VNA. As the VNA, we're working under doctor's orders. It's considered skilled care, and that's the kind of care that we do in conjunction with the physician, and it's very strict with regulations, and we bill insurances. And then the other part of our job is what we call the public health piece, which is what we've been doing in all towns, I believe, have a public health department, where we're doing visits that are more like wellness community visits. We do blood pressure clinics. We do the Rabies Clinic, which we have yearly. We have the flu clinics. We also work in conjunction with some of the other departments. We're on emergency preparedness organizations. We work with OASIS, which is Organizations Against Substances in Stoughton. And we belong on a lot of different committees and organizations and groups that are really trying to enhance the wellness of our community. One thing that I love about our agency, the Stoughton Visiting Nurses and the Public Health Department, is the rich history that it has in the town of Stoughton. It actually was started in 1910 by the town physician that wanted somebody to help him make rounds to all the sick people in the community. And the first nurse her name was Alice Murphy, and she served the town of Stoughton for 40 years, and she was amazing. She started so many public health activities in this town. She went through 2 world wars, and she was out there serving the community, and she was the one actually that founded a lot of the things that we do today as far as public health goes. She had TB clinics, she had wellness checks, and she also did skilled nursing. I think it is a nice thing for us to remember where we started, and I hope that she would be proud of the work that we're still continuing on the town's behalf. One of the things that makes us unique for the Stoughton Visiting Nurses and Public Health is that we are only one of 2 town-owned agencies in Massachusetts. It means we're a certified agency through the Department of Public Health and the Centers for Medicare and Medicaid. This is a very special service. The differences of what is allowed under just a public health and being a certified agency are very different with regulation as far as the treatments that we can do for patients. Our town has always been very passionate, and I think that's what makes us different. And the fact that we still have a VNA, I think, is a credit to the town. Our patient care surveys show that people are really satisfied with the work that we do, and our outcomes are very good. And that's really the goal of healthcare today, is to really give quality services, improve outcomes, prevent rehospitalizations, and to just promote the wellness of a community. So that's what we're really working on here, and I think we're a dedicated group, and I'm very proud of the organization that I joined 27 years ago.
Well, I think the Stoughton VNA is the best in the state. They're very loyal, they're very caring, very warm, all of them, all the nurses.
From my experience is that they really look after the people, look out for their wants, find out if there's anything they need. They're very, very good.
That they're special because they're very devoted and very caring about this, about their patients, and they're a fun bunch. Besides being so knowledgeable, they're really very nice people to meet.
It's better to have your home people looking out for you. That's the best I can say.
Hi, we're at the Senior Center in Stoughton, and we are at the VNA's weekly blood pressure clinic. And this is a really important service to the town. We're able to mingle with seniors and whoever wants to come up here and have their blood pressure checked. And it's we have Rhonda, our visiting nurse, here checking Rose's blood pressure. And the good thing about this is that it gets people out, they're taking care of their health. Sometimes they have questions for us. If we see that somebody maybe needs to see their doctor, we'll make that recommendation. If people can't get out to the weekly blood pressure clinic, it starts at 10:30 on Thursdays. We are available to check blood pressures in our public health office at the town hall. So we usually try to save on Thursday afternoons from 4 to 6. For people to come up, we call it Converse with the Nurse. Hi, this is our annual Rabies Clinic sponsored by Stoughton Public Health in conjunction with Dr. Arthur Mallock from Lloyd's Animal Hospital. And as a public health activity, we like to donate our time to keeping our animals well and safe, and thereby keeping their residents safe as well. So we sponsor this annually at the DPW. It's a great event. People come out, it's a beautiful day to make sure that their cats and dogs are kept healthy. So we've talked about the important piece of the past and the history with Alice Murphy and how we've continued to do the good works that Alice did. But as we're thinking about the work we do today and what we're going to do in the future, one of our goals here at the VNA is to expand our insurance contracts, which is something I'm actively working on right now. We hope to be able to offer our services to even more people in town, whereas right now we take Medicare, Medicaid, and we just got a Harvard Pilgrim contract, so that's great news for the town. As we look forward, there's other things that are coming along in healthcare, such as community paramedicine. So I think Stoughton's probably going to be ahead of the curve by having their own VNA. Even though healthcare changes we go through all the times, people still have that basic human need of just having a really good, skilled caregiver, good services, and to know that people care about them and listen to them. And I think that's what we do here, and I think we do it really well. So we appreciate all the town's support. Our residents are the best advocates. So if people are trying to reach us, they can reach us at our office number, 781-344-7011, or if they call the main town hall number, you can get connected from there. Also, I just want to mention that our nurses are on call 24 hours a day, so that when we have a patient on, they're never left alone. We always are connected to them. So it was really nice doing this video. I hope people have a better understanding of what we do, and we're here anytime anyone has a question. Feel free to stop by our office at the town hall. We'd be glad to talk to you. Thank you so much.